Great. Well, welcome everyone. So excited to have you here with us today. Another very, very important topic that we want to cover since it's PCOS Awareness Month, given that PCOS is so prevalent nowadays, whether you've been diagnosed with it or not diagnosed with it, or you have primary PCOS or secondary PCOS, it's definitely a hot topic among women, gynecologists, nutritionists, integrative medicine practitioners, because of the nature of the complexity of this disorder and the varying faces it has and it presents. So we're very excited today to talk to you about understanding the root causes that drive PCOS and how you can actually address them in a much more effective manner than simply pharmacological intervention. So thank you so much for joining. I'll pass over to Farah to introduce herself.
Sure. Aman, okay, if you want to keep checking, just in case there are people in the waiting room.
Yeah,
Okay, okay, thank you. Hi, everybody. Well, good afternoon if you're in the UAE, or good morning, maybe if you're elsewhere. I hope you're all well. Just a very quick introduction. I'm Farah. I'm based in the UAE, and I specialize in integrative and functional nutrition. So I'm really passionate about gut health, hormonal health, autoimmunity, and really we decided to do PCOS because I think Amal and I are both seeing more and more women, honestly, of all ages, even teenagers, coming to us with this issue, and they all are on metformin, or they've been told to take metformin or medications. And we want you to understand this condition better, if you have it or if you know somebody who has it, and empower you to really again, to empower you with understanding what it is, but what you can do about it in a natural aspect, as opposed to directly going to medication, because actually medications can sometimes make it worse. Okay, so I hope this is going to be an informative webinar. It's our fourth, I believe, and hopefully we're planning more in the upcoming months. So if you have any topics that you really would like us to cover, please feel free to give us suggestions. You can always just type any questions in the chat box and we can answer them throughout. So yes, enjoy. And thank you for being here.
Thank you so much, Farah. Okay, let's get started. Please bear with me because I need to just set up my screen in a way that allows me to also admit people in case that happens during the call. More and more security by Zoom makes things always fun and entertaining. All right. Okay. All right, let's get started. Right, so PCOS. I can see a few familiar faces here today, and very excited that you guys have joined. Thank you so much. Okay, so just a quick disclaimer before we get started. A lot of the information that we are presenting today is for educational purposes only, and it's not intended to substitute for professional medical advice, diagnosis, or treatment. So we're going to talk about underlying causes. We're going to talk about nutritional interventions. We're going to talk about supplementation. We're going to talk about medication. But again, none of please do not take this as advice for your own personal PCOS management, or those that you might know have PCOS in your circles. This is intended for educational purposes, and you should always seek medical advice and guidance, because as you will see, PCOS is very, very personal, and the causes are very personal. The symptoms vary, and as such, the treatment needs to be very personalized. All right, so PCOS Awareness Month. Why is it such a big topic, and why does it get a whole month of awareness on it? again, because really there's up to even 10% of women have PCOS. It's the most common endocrinopathy that affects women, and it's normally defined as high hyperadrenergic state, i.e. high levels of male sex hormones. Now, women in PCOS may present with various symptoms such as obesity, amenorrhea, so loss of a period, oligomenorrhea, so changing in period, infertility. It's really the #1 leading cause of infertility. Many patients I see in the clinic, for example, have luteal phase dysfunction or estrogen dominance, and it's when you dig deeper, it's commonly as a result of having PCOS in the first place that went underdiagnosed. Plus adrenergic features such as acne, facial hair, and so on. And one of the things that is critical or concerning about PCOS is that it actually increases the risk for both diabetes and cardiovascular disease, and it actually increases the risk of myocardial infarctions by seven times more than the normal. And we know that their research has shown it has also increased risk of endometrial cancer. So it's not to be taken lightly at all. However, it's not doom and gloom, because as we can explain to you, there are key drivers that promote the development of PCOS that we need to be aware of and can be altered quite effectively. So it's difficult to diagnose because, again, it's a syndrome, not really a disease, and the effects that it has are quite multifactorial, as we discussed. So, and it involves insulin sensitivity and resistance, and insulin signaling, and glucose intolerance, and we're going to come to talk about that. But the frustrating part is that it takes up to 3 years for a diagnosis to occur, and commonly patients are then put on a birth control pill, which is not really the solution. It simply masks the symptoms, or they're put on metformin for many, many years without actually looking at what is potentially the underlying cause. So let's redefine the problem, because that's really important. What is PCOS? Is it simply a high testosterone? Definitely not. PCOS is a multifactorial condition, and as such requires a very multidimensional approach. And this is where functional medicine really shines, because we really look beyond the ovaries and the pituitary and the hypothalamus, which is commonly the old way of thinking as the only drivers of hormone balance in the body. So when we think about PCOS, it's really a genetic, a hormonal, metabolic, and reproductive disorder. Okay, we see here's some facts from about PCOS, and it's, as I mentioned, 1 in 10 women experience PCOS, and 10% of that is in the childbearing age, and 50% of them go undiagnosed. And 50% of them go on to develop type 2 diabetes, and it's a really, really huge number. And as we're going to see, the symptoms are quite varied. So when we really think about treating PCOS, we think about inflammation, or the common term now that is used is inflammaging, so high oxidative stress and low antioxidant capacity in the body. There's a dysfunction in gut health normally associated, and there's intestinal permeability, as well as the most important traditional as well as the traditional considerations, which are looking at hormone balance, insulin, and cardiometabolic health. So insulin resistance really comes at the core of PCOS, because I'm going to walk you through the pathophysiology and why it all starts there. Is because hyperinsulinemia occurs in a large percentage of PCOS. It's really the #1 cause or underlying cause of PCOS that we see. More than 70% of patients, even those that I see in the clinic, have some form of insulin resistance. And it doesn't mean that you have to be overweight to have insulin resistance. You can be skinny and have insulin resistance. And there are two parts to this. First, cells in the body, including the ovaries, become resistant to messages from insulin to take up glucose. So we have too much glucose in the body, insulin is trying to put it into the cells. So ovaries become sensitive, and so the blood sugar rises. And in response to that, the pancreas then keeps trying to tell the Theca cells in the ovary to do their job by to release more and more insulin, and this is hyperinsulinemia. And one of the problem is that it results in an increase in testosterone, which leads to the bothersome symptoms that you see with acne and facial growth and so on. So while the root cause is not necessarily, it remains a little bit unclear from person to person, we know that for sure a most common thread is insulin resistance. And many patients, some of you probably included on this call, have been treated with metformin, which is a drug that usually improves insulin sensitivity and might restore inflammation and ovulation. However, there are many alternative and complementary interventions that we're going to talk about today, especially that metformin doesn't come without any side effects that we need to take into consideration. So we need to really look, when we think about PCOS, we really need to think about a very comprehensive approach and evaluation to the patient that's sitting in front of us. So as a result, PCOS is not really deemed as a disease, okay? So it's not like, oh, you diagnosed with PCOS, here's a set of symptoms, here's the treatment, go off. No, it's actually a constellation of symptoms. It's a condition. And there are different types of PCOS that are common, that are now defined. So you have classic PCOS, and that's where you have a high androgen state, male hormones, so testosterone, DHEA, DHT, and irregular or absent ovulation, plus polycystic ovary, so cyst on the ovary. The second type of PCOS is hyperadrenergic anovulatory PCOS, which is excess of testosterone and irregular or absent ovulation. Doesn't necessarily mean you have to have a cyst. Ovulatory PCOS, on the other hand, which is the third type, is where you have irregular or absent ovulation along with the presence of cysts. And then we have um, uh, um, and then we have non-hyperadrenergic. Again, that's very similar, where we have we do have absent or irregular ovulation, presence of cysts, but we don't have high levels of testosterone. And then the fifth type that's been recently more proposed is obesity. So women that have already insulin resistance causes their testosterone estrogen to be out of balance and result in overdrive and production of these hormones. And as a result, these patients tend to develop a form of PCOS when they have where they experience also acne, facial hair, as well as irregular absent ovulation. So you can see there's quite a variety, and if you do develop PCOS, whether it's classic or ovulatory or so on, you can actually, if it's treated incorrectly or not diagnosed correctly, you can actually shift between those types. And it really has many faces. I feel like when I think of PCOS, I think of it as a kaleidoscope because it can present with so many different, it can present differently in so many individuals. So, you know, you have weight gain, but some people don't experience the weight gain. You have menstrual irregularities when some people have regular periods. However, they do have PCOS where they experience the high androgenic state with acne and facial hair. Some people have absent periods, full stop. And some people have absent periods with or without ovulation. Some people have heavy menstrual flow and pain. Some have abnormal mid-cycle bleeding or spotting because of reduced level of progesterone around ovulation, or they have acne on the back of the chest, they have excess hair loss, history of ovarian cysts, recurrent miscarriages, infertility, and so on. So really the constellation can vary from patient to patient, and that's why it's necessary that we take a very thorough history of the patient and understand what type of PCOS they fall into, and then what are the underlying causes of this imbalance. But in reality, a key take-home message for you that I want you to know is that the birth control pill does nothing to cure, to prevent, or fix PCOS or any other hormone disorder, in fact. Okay, it can only be helpful as a management tool for symptoms, but ultimately it just masks the problem. because you need to think about birth control. Actually results in massive depletion of major nutrients. That Farah is going to cover this in the nutrients that are important for healthy hormone function. And all of these nutrients, such as B vitamins, magnesium, D, zinc, all of these get depleted significantly by the pill. And the longer you are on the pill, the more chances that you are going to develop imbalance is in your hormone. Because when you're really on the pill, you need to think of it. You're not really having an actual real period. You're kind of having you're having sort of a retrograde bleed. So it's a synthetic way in which we regulate hormones, but then we're not actually empowering the body and fixing it to go into to become balanced um, and so that it can have a normal cycle. So let's look at the understanding the root cause. Okay, so at the base of PCOS, you got to think about insulin resistance, inflammation, and hormone dysregulation. That's really the three things that I want you to remember about PCOS. Sorry, more people joining system. So let's start with just some menstrual cycle 101. We know that the menstrual cycle, on average, 28 days. It varies between women. It can be up to 38 days. That's normal. There's inter-cycle variation within for the same women, and also there's variation between women. So there's no set rule that your period needs to be 28 days and you must ovulate at day 14, and that it has to be right on the dot every month. It actually varies. That's the beauty about our human bodies. It's very individual. So, but it's important that you get familiar with your period, that you understand your period, that you know how long is your period on average, and when do you normally ovulate, how long do you bleed for, what type of bleed it is, etc. So really, I encourage you to get familiar with your periods. Because when things are off, the period is a very good signal that there's an imbalance in the body that you can then tune into and address before things worsen further down the line. So we have the follicular phase, which is basically where you have, it's the beginning. So the beginning of the cycle starts with your period. It can go up to 7 days, for some people 10 days, right? And that's where the uterine wall is shedding, okay, because there no implantation had occurred, right? And as you can see here, you can follow the different hormones. So FSH and LH, follicle stimulating hormone, luteinizing hormone, they are produced by the pituitary gland, and then estrogen and progesterone are produced by your ovaries. In the follicular phase, what we're doing is we're getting the uterus lining ready for potential implantation, and we're promoting the development of the follicle in the ovary for it to be then released during ovulation. At ovulation, we see an increased surge in luteinizing hormone, and we also have a high surge in estrogen. And then that drives in ovulation, and then we see a beautiful rise then in progesterone to help promote implantation should fertilization occur. So the luteal phase is where we are, where potential pregnancy can occur. However, there's really a lot more to the story than simply what the pituitary does and then what the ovary does in response. It's a very complex web of communication that really starts at the hypothalamus. So the hypothalamus dictates the hormone release from the pituitary, that then dictates what happens in the gonads, i.e. the ovaries or the testicles. But of course, here we're talking about the ovaries. And then from the ovaries, there's a feedback loop that goes back to the hypothalamus and the pituitary in order to regulate the cycle. So you see, it's quite complex. We have early to mid follicular phase, late follicular phase, then early to mid luteal phase, which is your primary fertility window, and then the late luteal phase. So any disruption in the hypothalamus or the pituitary can have a significant impact on your hormone health. But then if we look a little bit deeper, so we used to think old thinking, that's it, right? We need to just worry about the hypothalamus and the pituitary and the ovaries. And then if we fix those, then the problem should be fixed. But actually, new thinking tells us that the body, nothing exists in a vacuum and everything is interconnected. So we know actually the picture is much more complicated. We have the liver is very much involved in your cycle, because the liver is involved in the detoxification um, uh, um, of and the metabolism of your sex hormones and the recycling of sex hormones. The gut is very critical, because not only is it responsible for also recycling hormones, but it's also responsible for the production of the cofactors necessary to produce hormones in the first place. It also is a big window to potential inflammation that can lead to insulin resistance, that can lead to hormone imbalance. The adrenals, absolutely critical. The adrenal gland, which is commonly known as the gland that produces cortisol, our stress hormone, well, that actually is part of the story, because the adrenals not only produce cortisol, which we'll talk about shortly, can have a profound impact on your hormone balance, but also the adrenals are responsible for producing DHEA, which is the precursor to testosterone. And then actually estrogen is made of testosterone. The thyroid also has a really important role in hormone production. We won't cover that today because we don't have enough time, but you can refer back to our thyroid talk where we touched on this in our earlier functional health talks. And then, of course, insulin at the heart of it all. So there's a lot more that we need to consider when we think about PCOS beyond just the HPA-O axis, which is the hypothalamus pituitary ovary axis. And then actually it even becomes a lot more complicated. And I don't mean to scare you, but the intention of showing you the slide is that the hormone therapy is really an art. It's not just simply a science, because when we think about hormones, we only think about testosterone, estrogen, and progesterone. But there's a lot more to the story, because all of your hormones actually come from cholesterol. If you have reduced levels of cholesterol in the body, then you end up with reduced hormones. There's an imbalance. Vice versa, imbalance in your sex hormones can result in an alteration of your cholesterol levels. We know that PCOS commonly we see elevated triglycerides and cholesterol. We also know that if you can see here from the slide, there's so many enzymes and steps involved in producing cortisol, producing progesterone, and producing DHEA, that then produces testosterone and estrogen, and then we go into the metabolism part of those hormones. So there's a lot of enzymes involved that can go out of balance, i.e. they can be impacted by various factors that can either upregulate that conversion or downregulate it. So let's take, for example, testosterone. So estrogen comes from testosterone. So when we look at estrogen, things that can increase the conversion of testosterone to estrogen can be things like excess adipose tissue, so fat, excess fat, alcohol, zinc deficiency, stress, hyperinsulinemia, inflammation. So all of these things actually increase aromatase and cause more testosterone to be converted to estrogen. Not necessarily always a good thing, because if you end up with estrogen dominance, where estrogen is too high, progesterone is too low, then we get an imbalance, and also that results in luteal phase dysfunction and potentially infertility. When we think about what inhibits that aromatase, where we end up with too much testosterone, we think about smoking, and certain medication. And then we look at, so what I want you to think about it when we think about the hormone pathway, think of it as train tracks. So it all leaves the station from cholesterol, but then it can go down different paths. It can go to produce progesterone, it can go down produce cortisol, it can go down to produce DHEA, and then from there testosterone, estrogen. If we have a requirement by the body for any of these train tracks more than the other, then we're going to see more train tracks travel down that particular track, and then we end up with depletion on the other one. So it's a really fine balance that we need to address when we're intervening for hormones. Just giving a replacement with birth control doesn't solve the problem. You can see that estrogen, testosterone are at the end of the line. We need to work our way up and think more upstream. So let me walk you through what is the pathophysiology in which you develop PCOS. So we know that genetics, endocrine disruptors, diet, and lifestyle have a massive impact on driving insulin resistance. And we know that insulin resistance is the primary driver of PCOS. So elevated insulin.
Dietary. Dietary.
I'm just going to mute. Yeah. Okay. So we know that elevated insulin is the most likely underlying cause, right? So elevated insulin leads to altered function of the hypothalamus. So it actually impacts the LH and FSH release. So we end up with more LHS is secreted, which causes more testosterone to be made. And then ovulation does not occur because FSH is too low. You need FSH to be high for ovulation to occur. And then estrogens are not opposed by progesterone as a result, and that causes excess estrogen. Elevated insulin also leads to decrease in your sex hormone binding globulin. Sex hormone binding globulin has more affinity for testosterone, so it prefers to bind testosterone rather than estrogen. When it's low, we end up with more free testosterone. That causes an imbalance in your hormones. Elevated insulin also alters the enzymes in the ovary to make more androgen. So you can see here, it actually it pushes the ovaries to produce more testosterone. And then this increase in testosterone has a feedback loop to resulting in even lower sex hormone binding globulin. And that increase then results in what we experience as high testosterone symptoms like acne, facial hair, so on. And we also see that we end up with an increased conversion of testosterone to estrogen. So we end up with estrogen dominance, imbalance between estrogen and progesterone. We end up with irregular periods or light periods or lost periods overall. So as you can see, there's a lot going on as a result of that just one imbalance. We're going to talk about other imbalances, but the insulin resistance is so critical to maintaining hormone balance in females. So in functional medicine, we really want to focus on treating upstream. We don't want to just treat, we don't want to intervene straight away in the hormones because that's not going to make a big impact. So what may be impacting your hormone balance? So what can be driving insulin resistance? Things like chronic stress has a massive impact on uh, on insulin resistance. And by the way, chronic stress doesn't mean trauma or just stress from overworked or you have a lot on from a psychological standpoint, but also excessive exercise is a major cause of is a major driver of elevated cortisol that leads to that phenomena of cortisol steal, where we have less progesterone and less other sex hormones, and we lead to an imbalance in PCOS. We see so many athletes who end up with PCOS because of the high intensity of training that they do on a regular basis. Then we look at gut health. Gut health is really critical. I'm going to touch upon it in a second on a slide. And then we talk about nutritional insufficiencies. So let's pick one, for example, zinc. Zinc plays a very big role in insulin metabolism, secretion, as well as its function. Because it helps cells to respond to insulin signals. So if you have low zinc, your cells cannot respond to insulin well, and then as a result, you end up with insulin resistance and elevated glucose in the blood. So zinc insufficiency has been associated with many conditions like diabetes, glucose intolerance, elevated lipids. So it's really important to assess zinc levels and ensure those are corrected. Some studies also show that if you give zinc supplementation in PCOS, it actually lowers both cholesterol and triglycerides, which we know are increased in PCOS because of insulin resistance in the first place. And also, zinc is so important for supporting egg cell membrane and maturation. It's also important for the sperms. So if you have low zinc, there's the likely that you have poor egg maturation, maybe lack of ovulation, and then poor penetration of the sperm into the cell. So really important to look at nutritional insufficiencies. And then we look at xenobiotics and toxins, PCBs, pesticides, xenohormones, those that are increased basically estrogen in the body, which leads to imbalance and essentially PCOS, genetic SNPs, MTHFR, very important enzyme we look at. And this enzyme is responsible for the detoxification of the breakdown of estrogen, and how it breaks it down is very important for us. Is it breaking it down to the good form or the bad form? And then we need to look at history of synthetic hormones use. So very common that we see the patients who come off oral contraceptive pills, they end up with oligomenorrhea or amenorrhea, so missed completely lack of period or imbalanced period, or symptoms of testosterone increase. And so the post pill syndrome is a real thing. And its expression in people varies depending on your background history. What is your health story? Infertility treatments also have an impact, and then history of physical and sexual abuse has a very profound impact on long-term uh, uh, hormone health. So let's talk about stress. So stress is really important, very commonly missed in patients with PCOS, because everybody thinks, oh, well, everyone's stressed, we don't need to worry about it. But it is really important, because as you remember from the pathway I showed you, cortisol is produced also from cholesterol, and it's one of those train tracks. If the body continues to demand more cortisol because you're stressed, or you're exercising really intensely, or you have an infection, or you have an illness, then you have less of cholesterol to make progesterone or the other sex hormones. And as a result, you end up with an imbalance. So stress is so critical to be measured. As I mentioned, the adrenal gland is actually responsible for producing almost 80% of your DHEA, which is the precursor to testosterone and estrogen. And it also it actually produces 25% of your circulating testosterone. So more stress drives up androgenic hormones, and then the more our weight, skin, and hair growth will be affected. So the stats show that 20 to 30% of women with PCOS have elevated, have adrenal gland involvement, i.e. the adrenal gland is is also another driver in addition to insulin resistance. But also, remember that cortisol can also drive insulin resistance. So you can see the complexity of the web that underlines PCOS. Okay. Let's talk about gut health. So gut health is so critical. I can take a whole session talking about this, but all I want to mention to you is that if you have any gut issues, be it IBS, SIBO, um, uh, consistent diarrhea, constipation, bloating, any of those issues can lead to imbalance in the hormones. Because this is a great article if you want to read it. It's called Dysbiosis of Gut Microbiome, the dogma theory. And the dogma theory shows that women with PCOS have increased markers of gut permeability. What we mean by gut permeability is the tight junctions between the cells in your gut lining are no longer tight, and they're open. And as a result of them being open, it leads to the leaking of bacterial toxins called LPS into the bloodstream. So they're seen by the immune system, and it results in inflammation because they're toxic. They're not supposed to leak into the bloodstream. And that in itself increases insulin. And then that insulin, as we talked of before, leads to higher testosterone production. And then that leads to disruption in follicular development. And that leads to potentially lack of ovulation or irregular or missed periods. So the dysbiosis, so imbalance in the gut flora, can account for actually all components of PCOS that we worry about. So we know that there's ovulatory disruption. We know that there's menstrual irregularities, and we know that there's increased male sex hormones. And so as a result, we can see that the gut dysbiosis impacts all three of those. So it's really important when we think about gut health is we need to explore it very well. We need to think about not just the hypothalamus, pituitary, adrenal, ovary axis. Now we have to add another one. We have to put the hypothalamus, pituitary, adrenal, gut axis, because there's a very important connection. Another important really connection actually I want to mention to you is when we think about the brain-gut axis. So the brain and the gut are very intimately connected, and where it becomes a problem is because the gut-brain axis controls serotonin production and ghrelin, which are involved in appetite regulation. So when we have an imbalance in the gut microbiome, that results in imbalance in serotonin and ghrelin. As a result, you end up eating more. That results in insulin resistance, and so on and so forth. And that kind of gives you the link of where you end up, how you end up with PCOS in that case, as well as insulin resistance and weight gain. So how can we manage it? It might look very overwhelming because you can see that it's the web of interconnectedness is so wide, but it can be managed. It takes time to balance the body because it depends on where you started, where you are along that spectrum of PCOS, but it can be fixed. So the key here is we want to treat the gals. Okay, we want to focus at the gut, which is looking at things like constipation, we're looking at microbiome balance, we're looking at potential IBS, inflammation, SIBO, and then we need to look at the adrenals. And with the adrenals, we're thinking about stress, we're thinking about cortisol steal, we're thinking about low progesterone or low DHEA. And then we think about the liver, which is the total body burden of toxins. Are we able to detoxify well? Do we have any genetic SNPs that don't allow us to do? Do we consume too much alcohol? Are we on any medication that impacts liver function? So this is really important. And then finally, and most importantly, is sugar and sensitivity. So we're looking at receptor sensitivity to insulin. We're thinking about insulin itself, we're thinking about glucose, and we're thinking about the thyroid. So always think about, when you think about PCOS, we need to treat the gals. So first, we test. We never guess. We always test. We don't guess. So for sex hormones, you always want to test them early in the morning. And it depends, of course, if you don't have a period, then that makes it very difficult. But nonetheless, you want to test in the morning. But those days that I'm giving you specifically here, if you have a period at the moment, and but still have symptoms of PCOS. So optimal testing window for hormones, LH and FSH need to be tested between day 3 and 4 because that's where we measure their highest sensitivity. Estradiol needs to be measured at day 7 because that's where we start seeing it peak. And then progesterone is between day 21, 25. And that's really why, because progesterone is a very indirect marker of egg quality, egg health, as well as ovary function. So and fertility. So if you have a missed cycle, it becomes very difficult to assess it accurately on those days, of course. And then testosterone and sex hormone binding globulin, they can be tested any day. Advanced testing that we do would include the Dutch Plus or the complete hormones. Dutch Plus is by Precision Analytica, or complete hormones by Genova Diagnostics, and or cycle mapping, or actually cycle mapping is also part of the Dutch test that you could do, where you can actually measure how the entire cycle looks like over a month, where you collect saliva over a month, and then you see exactly what your hormones are doing during that cycle. The equivalent test for it is called the Rhythm Plus from Genova. And those are, for me, go to with anyone with hormone imbalance, because you get a lot more from those tests than just serum tests, because they actually map that entire steroidogenic pathway that you saw. Insulin resistance is important, so looking at HbA1c and fasting insulin. Important to look at lipid panels because we know that triglycerides and cholesterol are impacted. And if we have an imbalance in your cholesterol, high or low, it's going to impact your sex hormones, because remember, all hormones come from cholesterol. Then we look at thyroid function. That's really critical, because actually you need T3, which is the active thyroid hormone, to shuttle cholesterol into the cells to produce hormones. So thyroid function is so critical. Then we look at gut health to test gut health. The best tests out there are the Genova Diagnostics GI Effects Comprehensive Test. There's also GI Map and GI 360. And then we look at nutritional assessment. As I mentioned, it's really important. We could do it either through serum, basic blood levels, or we can do advanced nutritional testing where we're looking at ferritin, zinc, vitamin D, and B, really important. So the solution is we want to treat upstream. We want to go to the source of the problem and not the symptoms, as we discussed before. So here's what we think about when from a functional medicine lens when we think about PCOS. First, we have to manage insulin dynamics. Whatever happens, insulin is one of the most sensitive hormones in the body. So we need to and a master hormone in the body. So we must address insulin straight as a first step. And this is really done through nutrition, exercise, and sleep. And Farah is going to talk about this in more detail. And then interventions that we use before we jump into pharmacological treatment with metformin are things like myo-inositol, which I'm sure many of you have heard of. Myo-inositol is great because it's an insulin sensitizer, but it also improves egg maturation, which helps with ovulation. And also increases sensitization of ovary to LH and FSH. So myo-inositol is a great one. Berberine is an excellent, also molecule that we use, because berberine helps balance insulin. It has antimicrobial effect that helps balance the gut microbiome. And it also helps with egg maturation. It's really wonderful. Myo-inositol, berberine, really great. Chromium, fish oils, and magnesium. Again, Farah is going to talk about these in details. And then we need to heal the gut. So first we have to manage the insulin, then we heal the gut, because the gut is the gateway to the outside world. So if we have a break in the gut barrier, then that's going to drive inflammation and insulin resistance. And no matter how much we try to fix the hormones, we won't be able to do it if the gut is continuously leaky. So we do that with pre and probiotics, L-glutamine, and colostrum. Among others. It depends on, of course, what your gut issues are. Then we support the adrenals, really important. Adrenals are so critical, as we discussed. Vitamin C is essential. It's preferentially stored in the adrenals and it's used by the adrenals. So we need to support the adrenals with vitamin C. And then we use adaptogenic herbs, apologies for the typo, adaptogenic herbs, such as ashwagandha, licorice, rhodiola, that helps balance your cortisol throughout the day and prevent that cortisol seal that we talked about. And also leaky gut, because cortisol leads to leaky gut, and also insulin sensitization. We want to reduce inflammation, really important, with things like NAC and glutathione and sulforaphane. Sulforaphane is the active compound that's in broccoli. Glutathione is your master antioxidant in the body that helps suck up free radicals and prevent that increased oxidative stress, which we know is a big factor in PCOS. And then acetylcysteine is actually the precursor to glutathione. So the body uses NAC to make glutathione. But NAC, not only is it an amazing antioxidant, but it actually also improves insulin receptor sensitivity. So it makes the cell more sensitive to take up the glucose from the bloodstream, so we can reduce that HbA1c level. And then this indirectly will reduce your testosterone levels, but also NAC improves spontaneous ovulation, and it's great. It's used also very effectively in infertility. And then we want to balance the hormones. So see, we have to go, like we said, we have to address insulin, we've got to heal the gut, we've got to heal the adrenals, we've got to reduce inflammation, support the liver. Then we address hormones. We don't start with hormones first. Hormones, it depends on where the issue is. Do we have estrogen dominance? Then we need to use things like calcium D-glucarate, DIM, curcumin, melatonin. If we have excess testosterone, things like resveratrol, sopalmetto, and zinc are really great. Low progesterone, we can use Vitex or chasteberry, or we can consider hormone replacement therapy with bioidentical topical progesterone. Again, you really need to work with the practitioner because all of this needs to be personalized to the type of PCOS you have and also the underlying drivers of your PCOS. And then we need to plug it into nutritional deficiencies like vitamin D, B, zinc, and ferritin. So what I want you to remember is that PCOS is a condition that's really primarily driven by insulin resistance, inflammation, and hormone dysregulation. And for us to begin to resolve that imbalance in the hormones, we've got to look upstream and figure out what is in your history and your current present is driving that elevation in your insulin, what's driving inflammation in your gut, and how can we reverse that in order to get the body to balance its hormone naturally. Because remember that you can affect and balance hormone levels without giving hormones. And we do that by taking care of the gals. We look at all the players in that complex pathway that have an impact on the downstream effect of your hormones. So if you address upstream, then downstream will correct itself naturally. But if you only work with upstream, all you get is a backlog, and that inflammation then will have to go somewhere else and will cause other problems beyond PCOS. So thank you so much for listening. I hope that was very informative for you. Please feel free to post any questions, and then I will pass over now to Farah to take us through the nutrition side.
Thank you so much, Amal. As always, you provide us with a wealth of information, and that's really very, very comprehensive. And it's great to see that there's a lot we can do in terms of PCOS. So PCOS is not all about the ovaries, but we have to address a bunch of other organs as well. So let me just share my presentation, and then I will continue from where Amal has left off. Oh. Okay, so as Amal was mentioning, we really, the importance of addressing PCOS at a level beyond the ovaries is extremely important. So essentially, we have to look at blood sugars. Insulin will increase the production of androgens and testosterone, both from the ovaries, but also from the adrenals. So the adrenals also release some androgens, testosterone. So the more insulin we have, this is going to trigger and stimulate the release of more and more testosterone. Reducing stress, nourishing the adrenal glands. Again, insulin and cortisol are both very tightly linked. Yeah, basically through diet, through certain supplements, botanicals, as Amal mentioned, things like ashwagandha, holy basil, we'll talk about those in a little bit, but those can really help in addressing adrenal glands, and also looking at the sympathetic versus the parasympathetic dominance. The sympathetic, where we are in a constant state of fight or flight, we really want to try and switch on the parasympathetic state, which is more a rest, digest, and recover state. So again, we'll talk about that in a little bit more detail. Reducing inflammation. When we talk about inflammation, we have to talk about gut health. Taking into consideration 70 to 80% of our immune system lies in our gut tissue. So if we have a compromised gut, if we have a leaky gut, then this is going to impact the inflammatory cytokines that are being produced. And these cytokines also increase the production of androgens. And then, and of course, chronic inflammation will lead to higher cortisol levels. High cortisol levels are pro-inflammatory, so it becomes a very vicious cycle. And then supporting detoxification pathways. So the liver is the main organ that's responsible for detoxification. And we are constantly being surrounded and bombarded, let's say, with toxins on a daily basis. So optimizing our liver function is extremely essential and crucial in order to help our bodies get rid of any toxins that could be accumulating and that could, for example, act as hormones. Okay, so or can disrupt hormones. And just rewinding a little bit to gut health, we also, if there is dysbiosis, so an imbalance of good versus bad bacteria, then there are certain types of bacteria that can help recycle estrogen, for example. So high testosterone, high estrogen levels can also sometimes go hand in hand. So estrogen dominance, for example, can also play a lot of, let's say, negative effects, or can have a lot of negative effects on overall health. So dysbiosis, or an imbalance in gut bacteria, can lead to the recycling of estrogen. Instead of the estrogen being, let's say, excreted in the body via the stool, for instance, then it's going to be recycled simply because of imbalance in gut bacteria. So gut health is extremely important, and of course, detoxification as well. So the importance of specific nutrients when we talk about addressing deficiencies that have been caused by the pill, or focusing on certain nutrients that can help with insulin resistance, those all come together. Okay, so anytime we speak about insulin and blood sugar imbalances, chromium always comes up. Okay, so chromium, a trace mineral, can really help in insulin signaling. It can help insulin work more effectively. So in general, chromium piconolate supplementation ranging from 200 to 1,000 micrograms per day can improve glucose tolerance. It can reduce glucose levels and improve insulin resistance in women with PCOS. Just a quick comment that any dosage or dosages that I mentioned, those are very general. Okay, so in order to determine what is best for yourself, you really have to work with somebody it has to be a personalized approach. Okay, so who can really identify the right plan, the right supplementation plan, the right botanicals, let's say, for you. Okay, so we have to look at the overall aspect, if you're on any medications, etc. Okay, so those are just very general recommendations and dosage guidelines. Please, in order for you, don't go and take things separately yourself. Okay, you need to seek professional feedback. So we can find chromium in certain foods. Broccoli is a great source, whole grains, potatoes, green beans, and some animal-based foods as well, like beef and turkey. Magnesium, so there's a belief that almost all women need to be on some form of magnesium. Magnesium can really help balance the HPA axis. It can also help in insulin resistance. It can support progesterone levels. It can improve sleep. We've also spoken about the importance of sleep and adrenal balance. Magnesium can also help reduce inflammation. So magnesium can really help if someone has insulin resistance, in order to support the cells in adequately responding to insulin and taking up glucose. Magnesium can be really effective. Okay, so the dose can depend. It can range anywhere from 300 milligrams per day, 400 milligrams per day, keeping in mind that there are different types of magnesiums. Some can cause some digestive symptoms. So it's really important as well to keep in mind that anytime you do want to take magnesium, you take the right type, and sometimes the dosing as well, because too much can, like I said, sometimes cause diarrhea, for example. Magnesium also, when we talk about PCOS, particularly the research has shown when it was given with vitamin E and zinc, the effects of magnesium was really improved. So magnesium can be found in a bunch of different foods. Avocados are excellent sources, dark chocolate as well, beans, legumes, almonds, and pumpkin seeds as well. Selenium and zinc. So selenium is a great antioxidant, and we've spoken about the role of oxidative stress and inflammation in PCOS. So selenium could possibly, so it acts as an antioxidant, but it could also potentially improve insulin sensitivity. Brazil nuts are an excellent source of selenium. Sunflower seeds as well, walnuts, salmon are great sources. Zinc can really help the body get rid of any excess testosterone. Okay, so we know that excess androgens, testosterone lead to all of these symptoms that arise as a result of PCOS. So the increased facial hair, for example, disruptions in mood, weight gain, So zinc can really help. Okay, so first and foremost, we always want to focus on dietary sources. So all of these nutrients that I mentioned. Okay, so sometimes extra supplementation could be needed, but we want to first ensure that we are meeting our needs through dietary sources. So excellent sources of zinc include beef, lamb, chicken, seeds as well, like pumpkin seeds, legumes such as lentils, chickpeas, and beans. Vitamin D, such an important nutrient for so many reasons. Okay, so whether it's immune health, whether it's to reduce, risk of cardiovascular disease, cancer, diabetes, and in this case, vitamin D deficiencies has been linked to PCOS, infertility, and even poor glucose control. Okay, so vitamin D can help in glucose metabolism, weight loss, maturation of follicles and eggs, and menstrual regularity. So usually it really depends on your levels. Your levels aim to have your levels between 50 to 80 for optimal health. So of course, if you are deficient or if you have insufficient levels, then you really need to take vitamin D supplements. The dose may differ, but sometimes for maintenance, and I find this in a lot of clients, that they reach the optimal level and then they stop taking their vitamin D supplements. So it's important to discuss this, with your functional medicine practitioner, that you might need to be on a maintenance dose, for example, 2,000 international units per day. Vitamin D is found in smaller amounts in food, fatty fish, eggs, mushroom. Our best bet is to get it from the sun, of course, to spend 20 minutes on most days of the week where we are under the sun with no SPF, exposing our arms, our legs, our face to the sun. Okay, so vitamin D, low levels of vitamin D has been found in most women with PCOS. Omega-3 fats are extremely important in terms of helping to control inflammation. They can also reduce testosterone levels. They can help regulate the menstrual cycle in women with PCOS. Okay, so omega-3 supplementation, or omega-3s in general, even from the diet, can increase the levels of SHBG, which basically bind testosterone and help reduce the free testosterone in the body. Okay, so fish oil, as I mentioned, can reduce inflammation, and it can allow cells to take up or to basically to respond better to insulin and take up more glucose. So omega-3 supplementation dose can depend. It can differ from 1,200 all the way to more than 3,000 milligrams per day, keeping in mind that if you are someone who is on, let's say, aspirin, then it's important, to discuss supplementation of omega-3 with your doctor. Dietary sources, of course, salmon, fatty fish, so anchovies, sardines, salmon. So having at least 2 to 3 servings of fatty fish a week, organic fatty fish. And then we also have plant-based sources like flaxseed oil, walnuts, chia seeds. Those are also sources of omega-3, but the rate of conversion so the type of omega-3 in plant-based foods, we have to convert it to the better or more absorbable form in the body, and that conversion is not always very efficient. Okay, so try to focus on getting your omega-3s from fatty fish. White fish as well does have some omega-3, but not as much as fatty fish. And then just one more point about omega-3. The issue with omega-3 is compared to omega-6 fats are important, but we are consuming these in very large amounts. So we want the ratio of omega-6 to omega-3 to ideally be 1-to-1, maximum, 4-to-1. But nowadays the ratio is more like 25-to-1. So we're consuming so much more omega-6 compared to omega-3, mainly from vegetable oils like canola, sunflower, safflower oil, corn oil. And actually omega-6 fats can also increase androgens and testosterone. Okay, so that's also why we really want to limit omega-6 fats in the diet. So supplements that could help, remember that it's an individualized approach. What could work for one person is not necessarily going to work for somebody else. And doses are also important. Okay, so we might have to modify these according to why this individual, why this lady has PCOS. And please remember that we cannot supplement our way out of inadequate eating habits and poor lifestyle choices. So we really want to focus on those first before moving to supplementation. So berberine, as Amal mentioned, is absolutely great when we speak about insulin resistance. So supplementation, again, can be just as effective as metformin. Okay, so in terms of improving hormone balance, glucose control, and insulin resistance. So even though with a lot of these supplements, there's the research is still ongoing, but there's a lot of individuals that claim to experience benefits. Okay, so we really always want to personalize our recommendations according to the individual. So even if some individuals, some let's say healthcare professionals will say, well, there's no scientific evidence to support this. There is some, but also the anecdotal evidence of individuals benefiting from this is worth a try, as long as there are no contraindications or other medical issues that we're dealing with. Cinnamon, okay, so that well-loved spice that we, many people add to just general cooking, culinary food. So it's been suggested also for improving insulin management, as it can improve insulin signaling. So it can improve insulin resistance in women with PCOS, okay? So this is something else to potentially consider. Green tea, when taken again in terms of a supplement, can help reduce fasting insulin, free testosterone, and inflammatory markers in individuals or ladies with PCOS. Actually, one thing that I wanted to mention, following on to what Amal was talking about, when she mentioned all these great labs that we have to take into consideration, when we want to get tested in general, whether it's hormones or others. Many doctors will see your levels, let's say insulin levels, fasting insulin levels within the recommended range. But what is normal is not optimal. Okay, so if it's within the range, the doctor will say you're fine, that's okay. But in functional medicine, whatever we consider, we have our own optimal range. Okay, so what is normal is not necessarily optimal. So for fasting insulin, we always want to see it as a single digit number, preferably less than 7. Okay, so again, some doctors, if it's 13, 14, 18, might say this is fine, but realistically speaking, we want to see it as a single digit, preferably less than 7. Back to green tea. So these effects, again, so the benefits of green tea supplementation, whether it's reducing inflammatory markers or improving fasting insulin, can be linked to its ability to reduce oxidative stress. And it can also increase SHBG, or sex hormone binding globulin, which binds to free testosterone, therefore reducing its levels in the body. Spearmint also has been shown in a few studies to reduce androgens. So it has anti-androgenic properties, and it can reduce testosterone, as has been shown in a few studies among women who have PCOS. Inositol, there are 2 types of inositol, D-chiroinositol and myo-inositol, and it's usually recommended to give those 2 together. Okay, so inositol is actually found naturally in beans, legumes, lentils, chickpeas, and even non-GMO soy. So a lot of women shy away from eating soy, whereas it can actually have quite a number of benefits as long as it's an organic, non-GMO type. And we also produce inositol. Okay, so research has shown that it can help reduce sugar levels, it can improve the body's use of insulin, it can help regulate menstrual cycles, improve ovarian function, and prevent hirsutism. So again, it's best to combine both of those 2 together, because this is what research has shown to be more effective in terms of insulin resistance and reducing testosterone. So Ovasitol is a popular brand actually that comes in a powder form and includes both types of inositols. Licorice root is very commonly used in Chinese medicine. It can help balance hormone levels. It's also used a lot for immune boosting. It can also help in irregular ovarian follicles. It can also reduce serum testosterone levels. Okay, so licorice glycyrrhiza. So the main active form in licorice is glycyrrhiza. So this has been shown to be, the potent active component that's responsible for the benefits of licorice root. Particularly when licorice root is combined with peony on a 1-to-1 ratio, this can really inhibit the production of testosterone. Okay, so potentially taking both of those together. Now, in very large doses, licorice can increase blood pressure. Okay, so if an individual has blood pressure issues or they're at high risk of, let's say, coronary heart disease or in general cardiovascular disease, then this is something we want to keep in mind. And then some additional supplements, again, very individualized. So NAC, as Amal mentioned, NAC and N-acetylcysteine is absolutely great for supporting the liver, supporting detoxification, improving sugar control, and helping with menstrual irregularities. Adaptogens, so there are so many adaptogens. In case of ashwagandha, holy basil, rhodiola, schisandra, but it's also important not to jump in and take these, without really researching it or discussing it with your functional medicine practitioner, because depending on how fatigued or how your adrenals are functioning, different adaptogens have to be taken depending on your adrenal function. So this is again something to take into consideration. Certain mushrooms, okay, so maitake and other types of mushrooms can also help in terms of inflammation, in terms of inducing ovulation in women with PCOS. Vitex or chasteberry extract is really fantastic in terms of improving progesterone levels, reducing prolactin levels, and also infertility. So palmetto with zinc as well can also help reduce testosterone levels. And supporting detoxification. Okay, so if we are not detoxifying very well, so what do you mean by detoxification? There are different, we mentioned that the liver is the main organ responsible for detoxification, but the kidneys also help in detoxification. The gut plays a major role in detoxification. Okay, so we need to support all of these organs in order to, to balance our hormones. So certain nutrients support detoxification. We mentioned a bunch of these: selenium, zinc, magnesium, and acetylcysteine, vitamin C, vitamin E, and also ensuring, this is something we take for granted, but regular bowel movements, pooping on a daily basis. Okay, so if you're struggling with constipation, trying sometimes taking magnesium, vitamin C, those can really help with constipation control. Flax seeds, chia seeds, so 1 to 2 tablespoons of chia seeds or flax seeds or psyllium husks, again, 1 to 2 tablespoons mixed with water can help with constipation. So regular frequent bowel movements are very important. Sweating it out. Okay, so another reason why we want to focus on exercise. When you sweat, you get rid of toxins. Increasing lymphatic flow through massages, infrared saunas as well can really help detoxification. So some other lifestyle changes, weight loss. Okay, so fat loss particularly. Not everybody with PCOS is overweight or obese. Okay, so some individuals are also have what we call a normal BMI. Okay, but again, with individuals who have a higher BMI or who have more fat, let's say, mass, or a larger waist circumference, definitely weight loss can help balance sugar levels, can help with insulin resistance, and can also help with hormone balance. Okay, so all of those are tied together. Okay, so so many individuals, I find a lot of my clients struggle to lose weight, even though they've been placed on metformin or they're trying to get their sugar levels under control, but there's definitely an underlying cause or causes as to why they are unable to lose weight. Okay, so we have to look at hormone balance, we have to look at gut microbial imbalances and insulin resistance. Okay, and of course, when you look at insulin resistance and inflammation, both of those go hand in hand, and cortisol as well. What diet is best? I think many are waiting for this slide, but unfortunately, I'm going to have to disappoint you and say that there's no one size fits all. You know, so many women will decide to cut out carbohydrates altogether, whereas, you know, it's still important to have certain carbs or whole grains. Okay, definitely we want to eliminate any simple sugars, whether a ketogenic diet is going to work, whether a low glycemic diet is going to work, whether a low carbohydrate diet is going to work. It's really going to be a very individualized experience. Okay, so sometimes, again, if it's not done in the right way, if these diets are not done in the right way, if calorie intake is really restricted, then that can backfire. Okay, so again, paleo, ketogenic diet, unfortunately, there is a lack of scientific evidence to support the use of any of these, but some women, you know, their personal experience, you know, they will say that it has, you know, let's say going on a ketogenic diet has benefited them, but it's not necessarily going to work for everybody else. Okay, so an anti-inflammatory diet is something we always want to start with. So possibly starting with an anti-inflammatory diet, potentially correcting some nutrient deficiencies, trying a few herbal supplements, and then, you know, if we hit a roadblock, then we have to go back and see, you know, what are the root causes, what have we not addressed, gut imbalances, and then we want to, you know, we might decide to give a low carbohydrate diet a try. Okay, so I would not suggest that a person directly jump, you know, on a gluten-free diet, on a paleo diet, on a low carbohydrate diet. Okay, I would rather look at the big picture and see what changes can be made initially. Usually increasing intake of anti-inflammatory foods, focusing particularly on colorful fruits and vegetables, particularly vegetables, herbs, spices, ditching sugars, processed foods. Starchy vegetables are okay, but again, in controlled amounts, focusing on gut healthy, fiber-rich foods, probiotic-rich foods like fermented vegetables, avoiding alcohol, dairy. If this individual is struggling with a lot of inflammation, then we might want to consider ditching or letting go of dairy and gluten. Okay, so if inflammation is also one of our common concerns. So again, it's very, very individualized. Having protein and healthy fats at every meal is so important. So protein, whether it's a plant-based protein source like legumes or beef, chicken, organic beef or chicken, healthy fats like avocados, nuts, seeds. And then there's a lot of, you might have heard about seed cycling. Some will swear by it, some will say there's no scientific data to support this, but what seed cycling is basically you're focusing on eating certain seeds, for example, pumpkin seeds, and flax seeds during the follicular phase. So the first, let's say 2 weeks of a cycle, and then after ovulation, focusing on things like sunflower seeds and sesame seeds. So those seeds are believed to, depending on where you're eating them in the cycle, to improve the, let's say, production in the beginning of estrogen, or then the production of progesterone later on post ovulation. So again, there's no harm in trying that. Whether it's going to work or not, again, it could for some individuals. We always have to address root causes of other imbalances and not, thinking that seed cycling is going to do wonders. Fructose. So just a very quick slide on fructose. The issue is the high fructose content, particularly when we are addressing, a high BMI, high inflammation, low physical activity, then high amounts of fructose, particularly when we're talking about high fructose corn syrup, sugar, honey, even healthier alternatives, let's say like dried fruit, dates, those can, in large amounts, again, in the context of inflammation, then those are not going to do any good, okay, in terms of insulin resistance. But when we talk about whole fruits that, can quickly be broken down by the small intestine, they're not really utilized by gut microbes, they're not going to affect the gut microbes in a negative way, whole fruit are it's definitely fine, even though they contain fructose, but it's still fine, okay, compared to high dose fructose when we speak about fruit sugar, or simple sugars, fruit juice, high fructose corn syrup, again, in the context of inflammation. Exercise, Emma did mention this, and I also wanted to re-emphasize that too much of a good thing can sometimes be detrimental. So athletes or too much strenuous, vigorous physical activity, especially in individuals or ladies who have hormone imbalances, is not always a good thing. Okay, so we still want to focus on exercise, so light exercise, also weight training. You know, lightweight training is great. Will no doubt have beneficial effects on insulin, blood sugar levels, lipid profile, inflammatory markers, hormone balance. So again, we definitely want to incorporate physical activity, but avoiding too much vigorous and rigorous exercise. And stress management. So we did speak about that balance between sympathetic and parasympathetic in the nervous system. So we want to focus on activating the vagus nerve, which will stimulate the parasympathetic rest, digest, and recover system. Okay, so things like meditation, yoga, taking walks out in nature, you know, again, meditating, laughter therapy, music, deep breathing techniques. So all those can really help reduce the sympathetic activation, the constant supply of cortisol, which will affect insulin and inflammation, and of course PCOS. So we can't underestimate the. We all know that, you know, we need to stress less, but I think coming up with let's say a weekly plan. What are you going to be? What's one activity that you want to focus on per week, and then building up on that. So really, I think planning beforehand and incorporating something that you think will work for you. Okay, so journaling is great, and gratitude, again, walking in nature is fantastic. Some essential oils that can help an insulin balance, cinnamon, oregano, lemon balm, lavender, those can be diffused or applied topically when they are mixed with some oils like fractionated coconut oil or almond oil. We have to minimize environmental toxins, of course. Again, a lot of these can act as hormones in the body. They can act as estrogen. So going for organic fruits and vegetables, organic foods, you know, avoiding plastics, using, let's say, ceramic cookware, having air purifiers, plants in the house that can purify the air, and using clean, organic, eco-friendly detergents and beauty care products. So to wrap it up, again, we really have to focus on blood sugar control when we address PCOS, blood sugar control, insulin resistance, and glucose management, the adrenals, detoxification, and gut health. So there's not a one-size-fits-all in terms of, you know, what diet is best. All our approach has to be personalized, but keeping an open mind that, you know, there are a lot of botanicals that can help. Nutrient deficiencies have a major role to play, and that we can really manage and address PCOS the natural way, as opposed to jumping directly to medications and hormone therapy. So thank you so much.